everybody. Tom Judd from CED. Having the privilege of interviewing Pedro Galvan from a clinical engineer in Paraguay that's in the Ministry of Health. So Pedro, tell us a little bit about yourself. How long have you been in clinical engineering?
Yes, I'm clinical engineer since 1991. I studied in Germany, biomedical engineer, and since then I am working at the Ministry of Health in Paraguay, working in application of medical devices in healthcare and also telemedicine since 2001 approximately.
So Pedro, obviously you're one of those young clinical engineers like myself, since you've been around 30 years, brother. That's great. So tell us a little bit about clinical engineering practice across your country. By the way, you know I've been to your country. It's a very beautiful place.
Yes, in Paraguay, as I was back from Germany, we don't have clinical engineers in the country, and I began to make a diagnosis of all the workload needed in the hospitals. And since then, I began to develop a curricula for the clinical engineering school in the country at the National University of Asunción. And we have the clinical engineering faculty in Paraguay since 2000 in the country. And at this time, we have about 100 clinical engineers in the country working mostly in hospitals countrywide.
Wow, that's great development work. And you have a national society as well. How has that gone?
We are working on this national society with the support of the Mexican Biomedical Engineering Association. But it's not enough at this moment to make a really association. You know, the Latin American people are not so easy to make an association maybe they have many concerns regarding time, regarding some visions to make us such a association.
Sure. Well, I know in this day and age where, you know, like in Colombia, people have really connected via social media around certain issues, working on, you know, developing health technology policy for that country. And I know we've talked about in other places, we need to first show value, you know, show the educational opportunities, show perhaps certification opportunities, and you know, work on issues that are important to people, like you're doing. So you're doing all the right things, and so after that, people will come after you know, build the right infrastructure. So keep on doing that great work you're doing.
Yes, I think that we will reach this moment in few months, because after this pandemic situation in the country was very clear for all the people that the clinical engineers can support all the health services and in a very huge manner if they are associated. And I think that is the most important what we learned from the pandemic time in Paraguay. And I hope that we can show you in a few months that we can build an association in Paraguay. They are, I think, very, very far, but they need a little impulse, you know.
Yep. So one of the incredible things you guys have done in Paraguay is your work through the Ministry of Health and Clinical Engineering, you and some of your colleagues around telehealth. And you know, CED talked about a year ago developing a telehealth initiative this year, and we did begin that, and then COVID hit. But of course, telehealth has become this huge part of healthcare delivery. And you spoke about that at our program last month, our competency program, or actually additional webinar on telehealth. But talk a little bit about how you're the country, really among many around the world, of not so many around the world, that implemented telehealth at the Ministry of Health level. and now you're pretty far along. I know you're using artificial intelligence and so on. Tell us a little bit more about that.
Yes, Tom. Maybe we have a few things we can be proud of in the country regarding our work as clinical engineers. At the first time, we have to convince all decision makers what the clinical engineer can make in the country in order to enhance the health system. And I think that with the telemedicine, with telehealth, we have showed all the decision makers that is one of the things that create equity and the universal coverage of health services countrywide. We have at this moment more than 100 cities, also community hospitals in our net, and we have performed more than 600,000 diagnoses remotely, and we have maybe more than $30 million as revenue for the country itself. We earn from the telehealth infrastructure we have in the country. Maybe one of the first country in Latin America, I'm sure that we have implemented through the Ministry of Health a telemedicine platform and countrywide.
Well, Pedro, I know you've been a key part of that, and I just appreciate your leadership in that area.
Thank you, Tom.
So, so as we approach Global CE Day, well, just before we get to a concluding remark, tell us a little bit about what you spoke about last month. I know you, once again, you know, many countries are saying, well, how can I use these new artificial intelligence tools in healthcare and in clinical engineering? And you're doing that in telehealth. And I know you mentioned about it a moment ago with what, a lot of hospitals and a lot of patients and a lot of visits through telehealth. But talk a little bit more about artificial intelligence use.
Yes, Tom, we became from health minister the challenge that we don't have much resources. That means RT, PCR, reactives and equipments and specialized human resources to perform all the COVID-19 diagnosis countrywide. We have only the infrastructure in big cities like Asunción, the capital city, and another few cities in the country. But the big challenge for us was to show that we as clinical engineers and as telehealth specialized people can develop some applications to enhance the country capacity to make the COVID-19 diagnosis using intelligence, artificial intelligence systems, and we performed that in few weeks in collaboration with other artificial intelligence enterprises we have contacted. And we have pretty good results using the telehealth with a sensitivity of 93% compared to RT-PCR. That means that we can use to make a triage for all the countrywide, and we only send to the labs to make the RT-PCR people who we are sure that they are developing the infection.
Boy, what a timely and targeted response. What a great job you guys have done. What, Pedro, in closing remarks, what would you say to clinical engineers around the world about your work in Paraguay?
I will encourage all the people, all the clinical engineers of the world to be creative and to be sure of the work they are performing at the hospitals in order to enhance the health situation and in all the countries around the world. And that's the first thing. The second thing I will suggest to make a clinical engineer network like IFMBE to support another countries with maybe fewer possibilities to develop such collaboration works, where we can do also as the impulse for all the people in the world.
Thank you for your encouragement, and thank you for your time, Pedro.
You're welcome, Tom.
Talk to you soon.
Thank you.